Hi all pals, in this vid I'll explain all you need to know about solving gas issues in your infants. When it comes to babies, there is a lot of new information to learn. You may have specialized in diaper changing, swaddling, latching the baby's mouth, feeding, and bathing so far. Similarly, your effort to specialize in burping the baby must have brought you to this video. In this video, you will find all the information you may need regarding burping babies. Burping in babies should be a routine practice during feeding. So, it is not specific to after feeding. Particularly smaller babies may have difficulty burping and may occasionally require your assistance to do so. Irrespective of whether a baby is fed using a bottle or through breastfeeding, it does not matter. In both scenarios, gas will be swallowed, and if you fail to burp the baby or provide assistance in burping, you will face a problem with gas. Let's ask questions and try to provide answers. Our first question is coming. Why do I need to burp my baby? Why do I need to burp the gas out of their mouth? Feeding in babies does not go as smoothly as you imagine, and babies also swallow some gas while feeding. Consider it in this manner. You are consuming a cola or soda. Afterwards, you believe the gas in your stomach is causing you discomfort. And imagine you are unable to burp it out. Your babies experience something similar after being fed. If you do not help, they will experience stomach bloating. In the end, their feeding ends early and they continue to feel restless because they are not full. We have three possible outcomes. They may cry from discomfort, which is the least desired situation. They may spit up or vomit, or their stomachs may fill with gas, leading to further issues. So our second question is coming. My baby has gas, how should I burp them? Are there specific methods for this? Burping after each feeding should be a regular part of your feeding routine? Let's agree on this. Of course, there are various ways to release gas. Now let's discuss them in detail. First method, over the shoulder. Classic burping position. Baby's head over your shoulder, stomach facing you. You can aid infants in burping by positioning their stomachs on top of their mother's chests. Since men do not have breasts, they will need to lift a bit higher and help babies burp over their shoulders to release gas. It would be wise to place a cloth or towel over your shoulder in case your baby spits up. What happens if you don't do it? You become a lucky parent, that's all. In the second stage, sit with support in your arms, as shown at the top. If you can't burp your baby in the over the shoulder, which is the classic position, or if it doesn't work, consider sitting your baby on your lap and make sure to support both their chest and stomach a bit with your arm during this time. This is usually the most effective way to burp a baby. In this position, the thumb and index finger are formed in a C shape, and the child's head should be held in a way that properly supports their chin at the bottom. Gently incline your baby's weight forward and lightly pat their back. This is generally considered to be sufficient. If it's not enough, meaning if the gas hasn't come out, continue. You can pat a little bit and continue to gently stroke. If the second method didn't work, we move on to the Superman method in your lap. As I mentioned, the classic method was the easiest. Tried one way, didn't work. Tried sitting on lap, didn't work. Move on to third method, folks. Lay baby face down on lap, achieve results. Support baby's head. Perform actions carefully in this age group, as babies usually breathe by inhaling and exhaling over their stomachs. Be cautious not to restrict breathing. If you would like to seek support from professors while carrying out these procedures, you can ask your nurse or doctor to describe, apply, and provide training on them for you. Our next question is, when should we burp our baby? When you start burping, your baby depends on their individual needs. As you continue to feed your baby, you will begin to learn how frequently they need to burp. In general, infants approximately should have their gas released every 5 to 10 minutes during a feeding session, typically speaking. Whether fed with a bottle or breast, it doesn't matter. You need to burp your baby at the beginning, during feeding, and at the end of feeding. And if you are switching from one breast to the other, you need to burp them, or at least make an effort to do so. Similarly, if your baby is trying to fall asleep at the breast, you need to burp them. If they will continue feeding afterwards, we put them back on the breast. If the baby keeps sleeping in this case, we should put the baby back in their bed and prevent them from falling asleep at the breast. This topic will result in babies being breastfed continuously every hour or every 2 hours until morning in the upcoming days. If you have a request for a detailed video on this topic, please leave it in the section below. I can also prepare the video ASAP. Our next query is, what is the recommended duration for burping our baby? Certain infants will burp so rapidly that you will not require to time it. They burp immediately, as soon as you remove them from the breast or bottle. Some may not be able to do it right away. Ideally, try the classic over-the-shoulder position for maximum comfort. If there is no gas release despite trying for 5 to 10 minutes, in that case, you should change positions and try different ways repeatedly, continuing this cycle. Until when? Ideally, I recommend making an effort to burp for at least 5-10 minutes after each feeding. What if my baby is not burping? What should we do? Do we need to do it forever? No, friends, some babies struggle to burp due to their anatomy. This is completely natural. If despite your efforts to burp in different positions for 5-10 minutes, the baby hasn't burped and seems perfectly fine, there is no need to try harder if everything looks fine. Maybe the baby hasn't swallowed much gas. If the gas hasn't come out and the baby seems uncomfortable or is spitting up, vomiting in this case, you should reconsider your burping methods. Maybe there could be something you're doing wrong in the methods you're using. After feeding, your baby may need to be held upright for a while to let gas and liquid separate, enabling gas bubbles to rise to the surface. You're not trying to burp, you're just walking your baby in your arms after breastfeeding or finishing the bottle. While cradling your baby in your arms, you can also attempt to burp them by softly patting or rubbing their back intermittently. If your baby is experiencing excessive gas swallowing and frequent gas-related issues, consult your pediatrician for a thorough evaluation. Request a comprehensive examination from head to toe to rule out possibilities like reflux and others. If necessary, follow the treatment path for these conditions. Let's wrap it up. What should I say as a final word? Contrary to popular belief, burping is not something that should be done after the baby's feeding. During the feeding process, if the baby continues to swallow gas, it is a situation that needs to be periodically released. Whether fed from mother's breast or bottle, babies will manage to swallow all kinds of gas during feeding process. Each feeding should be divided into 2 or 3 to release the gas accumulated in the baby's stomach before it descends into the lower intestines. Remember, once you trap gas in the stomach, whether you quart it or not, you can't release it from the top. It will pass through the small intestine, then go to the large intestine, and finally exit from his bottom, the rectum. This will also cause you to experience gas pain for approximately 2 days, 3 days. Remember, friends, gas issue is just one of the causes of colic. I had prepared a video on colic pains in babies that you can access at the top. However, unlike colic pains, if there are 10 colic reasons, only one of them is a gas problem. If you don't solve the gas issue, everything won't vanish by the 3rd month. With colic, we expected the pains to go away after 3 months. 3 years old, 5 years old, 10 years old, 50 years old. Of course, no need to burp the child's gas like before, they're not kids anymore. Yet, you may have gas problems. I'm explaining. Start with the easiest way, which is burping over the shoulder. If it does not come out, adjust positions. If it does not come out, start the cycle again from the beginning. If your baby seems restless, take more breaks during feeding and try to burp more often to relieve gas. I said 5-10 minutes there, but you can take your shoulder again and try to burp the baby if they have excessive gas in 2 minutes, 3 minutes. If no improvement despite efforts, make appointment with doctor, schedule examination in this manner. If you have any questions or new information you'd like to share about this topic or a different one, feel free to leave your comments or suggestions in the section below. I will try to create these videos for you as soon as possible. Take good care of yourselves, friends. See you soon. I hope all of you have a sleep without gas, happy, peaceful, uninterrupted, and of course, nights. Music, music,